Now I'm going to turn it over to Dr. Charles Lim, the physician-in-chief at Kaiser Permanente in Redwood City.
Thank you, Roseanne, and thank you, Darian. So I'll also like to start with sharing a little bit about my personal history. So I grew up in Boston, which means that I'm a big New England Patriots fan. I've always been a Tom Brady fan. So you can imagine having someone like Brady for 20 years and not having Brady again. But I feel like we're climbing back up again with our new quarterback. Having said that, what brought me to the Bay Area was really I had the privilege to attend Stanford University School of Medicine, and I think for many of us here, whether that's in the healthcare industry or outside, I think we come back to the Bay Area from wherever we were raised across the country. It's because of our experience, whether that's at Stanford or whether it's Cal or UCSF. So that's what brought me here, and I joined Kaiser Permanente because I believe in our model of care about prepaid health, and I think we'll get into the sort of some of the specifics of what that means. But currently, I live in Menlo Park with my wife and 3 young sons. And the next slide, please. So we're celebrating 80 years of Kaiser Permanente. And with that, I'd like to pay homage to our founders. So the person on the left you see with the blonde hair is Dr. Sidney Garfield. So Sidney Garfield was a general surgeon, and he did his residency at USC. And when he finished his residency, this was during the early 30s, during the Depression, there were no jobs. So as a physician and entrepreneur, he opened up a little hospital in the Mojave Desert at the site of the construction of the Colorado River Aqueduct. And that was the place where Henry Kaiser, who you see on the right, Henry Kaiser was he is an industrialist. He was like the Jeff Bezos and Elon Musk of the day. At the time, he was very influential. He was in construction, in engineering, and shipbuilding. And Henry Kaiser was a contractor for building that aqueduct and needed coverage for the employees. And the employees could not afford the fee-for-service healthcare. So he made an arrangement with Dr. Garfield to start the prepaid healthcare so that I believe it was 25 cents per day that a prepayment that Dr. Garfield would provide coverage for workers in that who are constructing that aqueduct. And we believe that this is a better idea for healthcare. And I'll just say that it's an idea, but I think over the past 80 years, we've been implementing that idea in many ways. Next, please. And one of the reasons why I joined is because I do believe in this integration of care and coverage, and that everything is under one roof. Next slide. Where your insurance company and your physicians, your pharmacy, and your hospital is all under one roof, and that everybody is aligned for patient-centric care that has the highest quality, care experience, care availability, that is the most affordable. Next paragraph, please. So, Kaiser Permanente, we are the pioneers of value-based care. And I think now we hear quite a lot of value-based care. And of course, there are many, many versions of value-based care. So Darian, at Sutter Health, you also have a version of value-based care. So for KP, we define value-based care as a model that improves health outcomes and increases access to affordable care through evidence-based medicine and a commitment to equity, simplicity, and aligned incentives across the system. Next, please. And this value-based care, we've been recognized recently, maybe about 2 weeks ago, by Forbes magazine. And this is a survey of 160 Americans rating what brand people feel represents value. And you see that the Kaiser Permanente brand was rated as on the top of the list. And you can also see the other brands that are out there, such as Costco, Lands' End, Toyota, and Southwest Airlines. Next paragraph. So I would say it's just not the reputation for our value-based care. We also have some outcomes that reflect that our model of care does improve mortality. And so this was published maybe about a month ago, a 10-year study comparing the all-causes mortality of Kaiser Permanente members across the country with the community where we operate, as well as the general American population. Next slide. And you can see that on the left, measuring the rate per 100,000 people, that in the blue line below, that Kaiser Permanente members in a span of 10 years have lower mortality rates when you compare to the national average, that's in the green, as well as the communities in which we operate. And on the right graph, you see that mortality rate for everyone, right, across the country is declining, and for Kaiser Permanente members, that mortality rate is also declining. Next paragraph. Next slide. So I'll just focus my conversation around Kaiser Permanente Northern California. As all of you know, Kaiser Permanente is throughout the United States, not every state, but in many states. And this is our presence in Northern California. So we serve 4.6 million members. So this is a full capitation. And we have about 10,000 physicians and 46,000 staff across Northern California. Next paragraph. Next slide, I'm seeing. And in San Mateo County, we have 2 medical centers. So I work at the Kaiser Redwood City Medical Center. So we have a hospital in Redwood City, as well as a medical office building in San Mateo. And next slide. And we also have another medical center in South San Francisco. And you see on the left is our medical office in Daly City. And on the right is our Kaiser South San Francisco hospital. Next slide. And this is a transition slide because I know that we'll be talking quite a lot about workforce planning. So this was an op-ed from a physician in the Bay Area speaking on a looming shortage of primary care physicians in Silicon Valley. So I'll stop there and thank you again for the opportunity.